everyone, welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we're going to be talking about stages of labor. What is labor? What are the various stages involved in labor? What happens during the stages of labor? By the end of this class, you should be able to answer this question correctly, because these lectures are going to be simplified as simple as possible. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about labor and the various stages involved in labor. What is labor? Labor is simply the process by which the fetus and the placenta leave the uterus. Labor is a process by which the fetus and the placenta leave the uterus. You know, after pregnancy, the next thing that should come to your mind is what? It's labor. It's the coming out of the baby. It's the coming out of the placenta. So labor is simply what? It's simply the process by which the fetus and the placenta leave the uterus. In labor, there are 4 stages involved in labor. There are 4 stages involved in labor. We have the stage 1, the stage 2, the stage 3, and the stage 4 phase of labor. The first one we're going to be talking about is the first stage of labor. During the first stage of labor, there is cervical dilatation. That is, the cervix dilates, and there's also what we call effacement. Effacement is simply the thinning of the cervix. The thinning of what? The thinning of the cervix. So in the first stage of labor, there is what? There is cervical dilation, and also there is thinning of the cervix. The first stage of labor involves 3 phases. The first stage of labor involves 3 phases. And I usually remember these 3 phases with this: LAT. L-A-T. LAT. LAT enables me to remember the 3 phases of the 4 stages of labor. So the first phase is the latent phase. The latent phase. The latent phase is the longest phase. The latent phase is the longest phase, and it is also known as the early labor. It begins at the very beginning. So in the latent phase, the cervix dilates between 1 to 4 centimeter. The cervix dilates between what? 1 to 4 centimeter. Contraction is every 5 to 30 minutes. Every 5 to 30 minutes during this latent phase, the mother experiences contraction, and each contraction lasts for 30 to 45 seconds. In the latent phase, the pain is usually very mild when compared to phase 2 and phase 3. In the latent phase, the pain, the contraction is usually very mild compared to phase 2 and phase 3. In terms of the duration, for first-time mother, it lasts close to 20 hours. For the first-time mothers that are priming, it lasts close to 20 hours. But for mothers that have given birth, it lasts for 10 to 12 hours. So at this particular phase, what we are ensuring as a nurse is to ensure the comfort of this patient. The patient could be very anxious. Most times during the latent phase, the patient or the mother is always at home. Till when it gets to the active labor phase, that is when you see them in the hospital. Then that takes us to the second phase of stage 1, and that is the active phase of labor. The active what? The active phase of labor. In the active phase, the cervix dilates between 4 to 7 centimeters when you check it. Then contraction is every 3 to 5 minutes. This mother or this woman experiences contraction every 3 to 5 minutes, and the contraction lasts between 45 to 60 seconds. When you put your hand on the mother's abdomen, the contraction lasts between 45 to 60 seconds. And the duration for this active phase is usually 4 to 8 hours. The duration is usually what? 4 to 8 hours. At this period, as a nurse, what you are expected to do, definitely you are going to see the woman in the hospital. You are going to take history because there's a possibility that the water broke at home. So you have to ask about the color of the water that comes out of the vagina during this period to know if there is meconium in it. Because if there is meconium, it simply signifies there could be fetal distress for you to know what to do. So you take history and analyze this and assess this patient properly when the patient visits the facility. Then also, you ensure comfort. You keep the bladder empty. You keep what? The bladder empty. Sometimes some facility, they catheterize the patient when he's getting close to the active phase of labor. Then the other breathing technique. You teach this patient deep breathing technique exercise. Then vital signs are very important. You take the vital signs and reassure the patient, because at this phase, the mother is in severe pain and the mother is anxious at this particular phase. Then that takes us to the third phase of stage 1. As the name implies, transition phase. It is transiting from stage 1 to stage 2. In the transition phase, cervix dilates between your 8 to 10 centimeter. The contraction is every 2 to 3 minutes. It's like bumper to bumper, back to back. Like every 2 to 3 minutes, there's a severe contraction, there's pain. So it can be back to back. Immediately one contraction finishes, the other one starts. Immediately, that's what I mean by back to back. So the cervix dilates 8 to 10 centimeter. Contraction is every 2 to 3 minutes. And this contraction usually lasts for 60 to 90 seconds. This transition phase is the most intense and painful phase. The transition phase is the most intense and painful phase. Most of the times, the mom don't feel like talking, like she's in pain, she's anxious, there's pressure in the rectum, and the mom might tell you, oh, I want to poo. You get, because there's pressure of that of the head of the baby on the rectum. Now, what the mother needs now is your support as a nurse, it's your encouragement, and also encourage breathing exercise. Then you have to monitor the fetal heart rate. You have to check for cervical dilation. You have to check for the effacement and the fetal presentation. So these are the 3 phases involved in what? In stage 1 of labor. And also what you should take note of is that ensure the cervix is fully dilated before you encourage mother to push. The mother should not push against a cervix that is not dilated, because this cervix can become swollen, they can become edematous, and they might never dilate. Then that takes us to the second stage of labor. And what happens during the second stage of labor? What happens majorly in the second stage of labor is the delivery of the baby. The delivery of the baby. At the second stage of labor, the cervix is fully dilated. For first-time mothers, it can last between 1 to 3 hours. But for mothers that have given birth, it lasts for just 20 minutes. In the second stage of labor, the contraction is same as the transition phase. The contraction is same as the transition phase. It occurs every 2 to 3 minutes, and also it lasts between 60 to 90 seconds. At the stage 2 of labor, what you have to do is to monitor this patient, observe the vital signs, check the fetal heart rate of this patient, and check also the changes in the perineum, encourage the patient, and also give epidural when necessary, because it's not all delivery you give epidural, especially if there's no machine monitoring the contraction level. Then the third stage, what happened in the third stage is that the third stage starts with the full delivery of the baby and ends with the delivery of the placenta. The second stage starts with the delivery of the baby and ends with the delivery of the placenta. It lasts between 5 to 15 minutes. The longer this phase, the longer the risks for infection and postpartum hemorrhage. So in this second phase, there are various mechanisms that are involved in the delivery of the placenta. We have the Schutz mechanism and the Dokan mechanism. In the Schutz mechanism, the shining part, which is the baby's surface of the placenta, is delivered first. While in the Dokan mechanism, the mother's part, which is the maternal surface, is delivered first. At this phase, the nurse monitors the vital signs of the patient. Oxytocin will be given. The comfort is also ensured. Perineal care is taken care of. Encourage mother and baby. Encourage mother and baby. How will you encourage baby? Baby is very small. Alright, I think encourage mother is better. Then assess the placenta and also check the cord. Ensure that the cord is well cleaned. Then the last stage of labor is the stage 4. The stage 4 is 1 to 4 hours after delivery of the placenta. 1 to 4 hours after the delivery of the placenta. At this stage, close monitoring of the mother and the baby is very, very essential. You have to also check for the fundus of the uterus. You have to ensure that the fundus is usually around the umbilical area. Then also you assess and observe the patient, that's the mother and the baby. Then also at this stage, the mother is at risk for hemorrhage and is also at risk for infection. You have to check the temperature, because the temperature, a rise in the temperature might signify a sign of an infection. Then you also have to check the BP. I hope this video helped you understand the various stages of labor. Don't forget, there are 4 stages of labor. In the first stage, there are 3 phases. We have the second, the third, and the fourth stage. The first stage involves cervical dilation. The second stage involves the placenta, delivery of the baby. The third stage involves the delivery of the placenta. And the fourth stage is 1 to 4 hours after the delivery of the placenta. Thank you very much for staying tuned. Don't forget to like, don't forget to comment. Don't forget to click on the share button, and don't forget to help share with a friend. I still remain as Messi Mary, popularly known as the nurse with the difference. Thank you very much.